Today, we are going to attempt to recheck all of our quarantine population. It's a lofty goal, but I believe we can do it. Our quarantine ends in about 2 days, and we have buyout next week. So we need to recheck all of the horses up here. Primarily, I check lung sounds, lymph node enlargement, temperatures. These guys are also due for vaccine boosters. And then we have a couple that need dental exams and or dental float still that were not our top priority dentals. So we're just taking it a patient at a time. Little Lulu is our first patient. She is walking so much better. I'm really, really happy with how she looks. Her feet aren't normal yet, but huge improvement. Temp is 100.3. Will you let me listen to your lungs? Hi, sweet thing. You're so cute. I'm gonna touch you back here, okay? Good girl. Good girl. I can't. We should check her teeth.
Okay.
Yeah, we should check her teeth. All done. Again, this is just a palpation. It feels like her teeth are like wider on the top than they are on the bottom, but that's all just food packed up there. I don't feel any pain or anything, and everything moves really nice and smoothly. So let's do dental rads before adoption, but I don't feel super worried about that.
Okay.
Yes. You get to go out. Yes. You're so excited. Yes. So excited. What? Come here. Oh, it's. Come here. You want stickies? No. Nope, not him. Okay. This is Tango. Tango is 2. He got brought to us today. He was in an owner surrender. He's a sweet boy. I'm gonna foster him for a while, see how he does. We're hoping he does good, and if he does, I think he might just stick with me. If he does good, I'm hoping he does good. He seems like a really sweet boy.
What caught your eye specifically with Tango?
As soon as they brought him through the door, my mouth dropped and I was like, oh my gosh, he's beautiful. And I told Miss Lynn, I was like, yep, I gotta have him. I'm hoping everything goes good. Maybe he will.
This is Luna. You ready for surgery? Pretty girl.
Good girl. I'm gonna touch her and kind of help guide her in. You're such a good girl.
The door forgot.
Good girl. Okay, I'm gonna start with 0.6. This sweet, sweet mare's name is Luna. She is amazing. She is an absolute sweetheart. She is blind in both eyes. I don't think this mare has seen in years and years. But in addition, you can see this discharge on her eyes. Her eyes are shrinking and she's got a little bit of entropion, which is this lid rubbing in. She's got a lot of irritation in this eye. So she can't see and she has chronic discomfort. So in my opinion, the best course of action is surgical removal of the eye. We are going to perform a bilateral enucleation on Luna today. So by removing those eyes, we remove the potential for any future discomfort or issues with the eyes. So we're gonna start with the left. We're gonna clip the whole area around this, scrub it, and then do our nerve blocks before we start the surgery. Oh, it's crunchy back there, holy moly. Basically, what we're gonna do today, I'm gonna sew these eyelids closed. I'm gonna make a little incision around the upper and lower lids of the eye, and then I'm gonna gently use gentle kind of curved surgical scissors and a scalpel blade to slowly work my way around behind the eye. So I'm not just taking the eyeball, I'm removing all of the glandular tissue associated with the eye. What you look at just looks like me chopping around, but there's a ton of nerves and muscles associated with the eye. I do really enjoy this surgery, but I don't remove things just because it's fun, just to be clear. You're gonna put your finger in the eye socket. right there, and you're pushing straight forward. Okay, let's see if you're numb. This is your last big muscle. So that's what we wanted to have happen. You want to note time out on the eye, and we'll look at that when we have time. I'm sure this feels very weird to her, having cold water sprayed inside her eye socket. So we are right at the average to shorter end of how long this procedure takes, and we're starting on the second side. That is a very unhappy vessel. This is always a really bloody surgery. Yeah. Like, it just is. You just. It only took 1 hour. Okay. I'm ready to irrigate. I think I'm just gonna have to pressure bandage her face, which I don't love doing, but she's got hematomas on both sides, so. Luna did great. We had a little bit of difficulty with the nerve blocks on the second eye, but overall, she's handled anesthesia really well. She's stayed comfortable, and uniquely, if she is in a confined space, walks in a circle, that's not great for her level of stress. So I love sunshine and exercise as medicine, and I think that's the best option for her. I think we're gonna let her go back outside with her buddies.
Come here and see what we got.
Come see what?
See what we got.
What do we have?
I'll show you.
It's something mischievous. Oh, I never come in here. What's going on?
Look at there.
Who is this?
I don't know his name yet, but
We don't have a name?
it's a rabbit.
There's a rabbit at Horse Plus. Y'all,
I think he's old.
I actually think this is the first rabbit since I've been here. This is...
And that
Look
water
at-
on his head.
Is it a guy or girl? Him?
Yeah.
Y'all.
Hey, do you want to see Barry?
Who's Barry?
I gotta show you Barry. Barry.
It's a rooster.
You want to pet Barry?
No, Barry's gonna attack me.
No.
Is Barry a nice rooster?
Yes.
I've been chased by one of these things before. You better be careful. I don't know, gosh.
Pet him.
All right, come here, Barry. Wow, got some gnarly feet,
He's
dude.
9. That's an
9.
old
How do you know?
rooster.
Wait, how do you know?
She told me, his old owner.
Oh, okay, so they know. Barry, look at this guy.
Look at that squishy face.
Barry, all right, you're adorable.
That's Mr. White.
Barry and Mr. White. So I just met Barry and Mr. White, Nicole.
We got some dogs, a large number of cats.
That means that we are having, today is Horse Plus Day. Like, we have double the pluses today that we normally do. That's the plus side of Horse Plus. The other small animals, Barry, Carl, Mr. White.
I like Barry. And I asked her if Barry would stick around. You know, I might need a barn rooster to go with my goat.
Have you ever been chased by a rooster?
Yes, by
I was gonna say, they'll
every
come
car
after you.
Rooster.
Yeah.
You wanted a car cat, you can have a car rooster.
Yeah,
car rooster?
the rooster can ride in the truck.
It is Tuesday morning here at Horse Plus. We've already had a busy morning. This beautiful, voluptuous horse specimen is Princess. We think that she might be pregnant, although I attempted a transabdominal radiograph without any sedation and without clipping. Our wonderful resident radiologist, Dr. Marina, is coming this morning to double check me, because if there is a baby in there, we want to know about it, and we also want to try to estimate fetal age if there is. Princess came from a slaughter auction situation with no known history. She's like 16. I don't trust my memory, but we also took some radiographs of her teeth this morning. They look beautiful. Just to be thorough, I'm gonna put the speculum on and palpate, because sometimes you can't see movement and stuff like that, but I don't anticipate that she's gonna need anything done with her teeth. And Dr. Marina should be here in 4 minutes for her pregnancy check.
Hi.
Hi, I know, you
You're
kind of awake.
not very asleep. Oh, you are not helping at all. She's just like dead weight right now.
Everything feels great.
Perfect.
One more arcade. Yeah, she doesn't need anything done.
Good job.
Sweet.
Poke. Two pokes.
Good girl. Did we note that she has scars over her withers, like in the region of the saddle? I'm gonna call her a 6 out of 9 because I actually would take a wee bit of conditioning off of this horse.
You've been here a while, or? Almost a month.
3-4 weeks. She has some mammary development.
Sedation on board. Let's see what's going on with you. Look at your belly. What a nice lady. What a nice lady. You do have kind of a big belly, don't you? Good girl.
So I can physically like be present back here, but this is a much more normal brood mare.
I love
like,
it. Right.
I've done rectal preg checks with these guys without any sedation, and they're like,
Unbelievable.
good girl. She's very relaxed.
All I see is GI and free fluid, so that's all I've seen so far. So you have not missed anything that
So
I have seen.
I'm at least encouraged that what you're seeing is about what we saw last time.
Absolutely.
Good girl.
Yeah, whether last time was a while ago or this morning, either way, I'm seeing what you're seeing.
Last week.
So this all looks like normal GI. Not
Fabulous.
seeing anything that looks like baby.
Just fat.
Yeah, I mean, maybe.
Yeah, this is all gastrointestinal stuff.
Beautiful.
So nothing that looks baby-like, but you're right, early pregnancy, sure. So Princess here is a little snoozy because she got some sedation. But she is a mare that has been here about a month, maybe?
About a month.
About
yep.
a month, and she's
about 15.
15 years old. Okay, and she's a little bit round in her belly, so Dr. Lydia wanted me to pop a ultrasound probe on there and check and see if we have any signs of baby. And so what we did was look at her belly with a transabdominal. So I popped the probe on the lower part of her belly in the back, and all I saw was the exact same thing Dr. Lydia saw, which is a bunch of gas, some small intestinal loops, some large intestinal loops, a tiny bit of free fluid, all things that should be sitting kind of right in that spot. Did not see anything that looked like a fluid-filled uterus or a fetus. And so if needed, at the moment, she's certainly not in mid or late term pregnancy. It's possible she could be early, but it's also possible that she's not pregnant. So she's fine to go join the rest of the herd, I think, and be with the other mares probably, right? Or
Yes. Once she's not sleepy anymore, she will go on our training schedule, and we'll see what she knows. It's like the gurgly toilet flush sound.
oh, okay.
Yeah. It's normal. It's just sometimes really hard to hear, and it's
Gotcha.
really nice and clear in the smell. Sorry.
Those are her boosters.
Hey, hi, good girl. Oh, hi. Hey, Alfie. Is this your adoptive mommy? All right, I'm poking over here.
I feel like we need to do like back rads on her. She's weird.
Maybe we did. Hi, my friend.
Confirmation
Yeah.
concerns. He's the wonky legged.
Look at him.
Yeah. Wonky legs.
So, and if you look at the bony columns, none of them are straight.
No, they're all like
on radiographs or anything else. So
That's the one we took, and the whole joint's like. Wee.
Yeah, exactly. So that's going to create uneven pressure on
Yeah.
those germinal cells.
Yeah.
So, you know, I mean, he's going to be high maintenance. We were due to recheck lymph nodes, temperatures, just kind of general health, and booster some vaccines for the guys in this pasture. So we did that. So we have Alfie, we have a 16-year-old standardbred mare named Twilight who's gained a ton of weight. Obsidian is our sweet, very older guy. He has a really severe abnormality in his leg, and he's very, very thin, but he did well, and we wanted him to have a little bit more time. He also has a pretty severe heart murmur. He was stable enough that we gave him some good time up here, but we probably are not going to adopt him out. But he's been a great babysitter. And then our last horse up here that we rechecked is Luna. She came into us blind with 2 painful eyes, and we surgically removed her eyes. She did great with surgery. She looks awesome post-op. I made a tough call to turn her back out. and she's doing really well. So normally we don't do that, but we didn't get any rain this weekend, and thankfully that all worked out great. So we're gonna go back up to the barn and run up our next group of quarantine horses to be rechecked.
This is pre-surgery vibes.
Yeah, let's go back in there. Hi, Muffin. You're okay. I mean, I can poke her right here. Good girl, all done. That's big. That's a big hole. I just gave her a sedative, so.
You probably don't even have 5 minutes because I hear Cody coming with Luna, so.
Good girl. We are in here this morning with Bella. She's a little yearling filly. She came in through our buyout program 3 weeks ago.
Yeah.
And she has a hernia pretty close to where her umbilical cord came out, and it is getting slightly bigger. So even though she's still in her quarantine period, we're gonna go ahead and do surgery to repair that hernia today. She's about to get her second injection of anesthesia drugs. Opening the abdomen is really serious in horses. As a general practitioner, I do not do abdominal surgery, but if it's just a little hole and we can freshen those edges and close it and put her in a belly band, we've had other young horses do really well with this procedure here at Horse Plus. So, okay. She's still really light, so everybody hang back for a second. Why is it hard now? This was not hard when she was standing. There we go. All right, that was a loop of small intestine that I just shoved back in.
So she just has her little pouch.
Yeah. So now it's just the pouch, but that answers our question about whether or not guts can come through. Okay, are we ready?
Yep.
Okay. So when I palpated this on intake, all I felt was fluid. I didn't feel small intestine. And just now, right before I'm opening, 100%, we had a big loop of small intestine. So I just kind of treat these like a dog abdomen, you know, where I'm gonna incise along here until I can see. Oh boy. You wanna see small intestine? Well, we got the abdomen closed successfully without any contamination, and any guts falling out. Her respiratory rate just increased. So we're happy about that.
Still under.
We're gonna do a 3-layer closure. So I'm closing the subcutaneous or the subcuticular layer. So I could have removed a bunch of this skin, but I like to leave it on because I feel like having a big, strong scar in this area is not gonna hurt her. We can't control what happens the whole rest of her life, so it's extra important in a filly compared to a gelding that we get this really well done, just in case something might happen and she might end up pregnant someday.
All right, so we're done, Dr. Lydia.
We are all finished. It went great. It was a lot bigger than I thought, and there definitely was small intestine hanging out right under the skin. But thankfully, everything went great with surgery. We got all 3 layers closed. She's done awesome at her anesthesia, and I'm really happy. So, yeah, she's gonna be in our hospital for at least 3 to 5 days.
Who is this right now?
This one is Spirit. I've been working with him off and on about 2-3 weeks now.
2 to 3 weeks?
No, about 3 weeks.
3 weeks, okay.
And he was wild, just hand fed. He couldn't pick up any of his hooves. I got the front to pick up,
Wow.
but the back I haven't picked up yet.
Yeah.
Yeah, as you can see, he's pretty good now. He can hold it up for quite some time while you're working on it.
Wow.
Then as he pull forward, he couldn't even pull his leg forward before. He would just fight it. But he's loving the stretch now.
Wow.
Yeah, he's coming out good.
He's doing great.
Big improvement on all of them. Molly's pretty good now riding. She's accepting different riders. Maximus is still under the saddle, but he hasn't accepted a rider yet. Talia's doing good. She's been ridden about a week or so. Spirit's been ridden a couple times, and maybe a few more times he'll be ready for the trail. But they're coming along well from when I first met them.
Y'all, we are so blessed here at Horse Plus. I mean, we just have amazing people here. We have people that are working with all of our animals, but especially our horses. you know, right now from Trey doing the horse gentling, Cydney handling all of our adoptions and intake process, our amazing vet team. You see them all the time on our videos, but we're just blessed. We're really blessed. You know, one thing that we deal with as an organization that every organization and business in the world, you know, has to deal with in some way, shape, or form, that's not our favorite thing is when employees and loved people of our organization end up stepping out and leaving. And this past week, Cody, one of our beloved employees here at Horse Plus, you've seen her on all of our videos. She's been here for quite a bit of time. She is no longer working here at Horse Plus, and it's hard on our team when stuff like that, you know, happens, because we hate to see people go in different directions. Life is like that, though. You know, life takes us different directions and has seasons for everything. And we're just so grateful for Cody and the work that she's done here at Horse Plus in every way. And so while you won't see her on videos anymore, just know she's a loved and cherished family member of Horse Plus, a very valued friend to all who know her, and will continue to be that way for sure. But she won't be on any videos going forward, and our team has been great, filling in the gaps and stepping up really big time. You know, Trey, just watching him work with these horses today, I've just been smiling nonstop. Just amazing. You know, we are blessed here with a fantastic staff.
Been a busy day at Horse Plus today. We rechecked everybody in quarantine, about 16 horses. And thankfully, almost everybody that we looked at today got cleared to go into general population, which is really exciting for me. I think this is one of the first quarantine groups in months and months and months that I haven't had a bunch of really sick horses that had to stay in quarantine longer. So we have a lot of horses that have never been handled before, and also a lot of horses that don't trust humans. But from a health perspective, we've had a great day. I have one more dental to do in this group, and otherwise we got caught up on almost all of the diagnostics and stuff that we have to do. So we are so thankful for this facility. It's still challenging sometimes to catch these horses. We kind of ended up with not quite as many bodies as we needed to catch horses, but we got a lot of exercise, and overall it's been a great day.
What are we doing?
Today we're moving horses. And
Moving them? Why are we moving them?
Well, we have horses from quarantine coming down.
Oh.
Quite popular horses. And this is how you move two horses that are best friends. You just grab one and let the other one follow. So
there you go.
Admiral's very excited and nosy.
Admiral's trying to figure out what's happening.
This is Gypsy and Stanley that we're moving.
Gypsy and Saline?
Stanley.
I almost heard that right, members. It's all right. I'll translate for us.
I'm a little bit sick, so it's fine.
It's all good. They look great. They look great. Where are they moving to?
They're gonna move with Molly and Trixie.
Okay.
So
just to a nearby pasture?
To a nearby pasture where we have like they're gonna probably be carrying on squealing, but we have a full gin pop of horses. I told you they'd squeal, didn't I?
You did. You called it.
All right, so we're gonna see how Molly likes them.
Okay. I love it.
All right, Stanley, come on, bud. It's a new pasture. How about that trick, Chris? The old best friend trick.
The old best friend trick. Just lead one, the other one will follow.
All right, on to the next one. Here they come. Jennifer, you can help run them down this way. Hey, 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 hey. All right, now to get 10-acre horses. No. I'm like, Peyton, if this horse comes to you, I would catch it because it's hard to catch. Hey, come here, treat. And if it comes up, grab its mane, don't let go. Oh my goodness, good job. Here's a halter and lead. Okay, come on out. So we just got done running horses and we probably look like a hot mess. But it was a hot mess in a good way. We just have a lot of horses that need Trey's training. We have a few wild horses that are quite popular. And then we have a few others that are just young horses, and we're really excited for them. They're really smart. We didn't have any panels broken. Everybody did great. Everybody was on the same page. We had some sweet senior citizen horses come from the 10 acre, and we're really excited. So y'all just stay tuned and watch our website.